You are a BCBA working with a 12-year-old client. The client is unable to dress themselves, which leads to embarrassment at school and at sleepovers. After 2 months of intervention, the client is dressing themselves at home, but reports that he was unable to put his pants on by himself while at a birthday party. This intervention lacks what dimension of ABA? Dimension questions are tricky because dimensions tend to run together. All of our goals, we want to be objective, measurable, socially valid, generalizable, adhering to behavior principles. And when we are considering all of these factors, we can get a little lost in what we're really focused on in the question. And remember, when we're taking our exam, we're answering what the question is asking with the given information. So it's important that you really understand the question up front. And in this case, we're obviously looking at a dimension of ABA. But what is going on in the question? What's important about this question that's going to help us here? Well, we know we have a 12-year-old client. The client is unable to dress himself or themselves, which leads to embarrassment at school and at sleepovers. Boom. That's going to be our priority. If our client is being embarrassed at school and at sleepovers, okay, these are not socially valid behaviors, we're trying to correct this. But what do? Well, we teach them to dress at home, but then they go to a birthday party and can't put their pants on. Did we really make a meaningful change? Well, no. Dressing themselves at home is not really the issue, okay? It's in public, at school, at sleepovers, at birthday parties where they need to dress themselves. So what have we failed to do? A, behavioral. Did we fail to pick a measurable, observable goal? Well, no. Dressing yourself is a very common goal. It's measurable, it's observable. Nothing wrong behaviorally with what we chose. B, effective. Were we effective? And this is where people get a little lost. They're going to say, well, we taught the client to dress themselves at home. What was the goal, though? The goal was socially, school, sleepovers. Our intervention was not effective if he's still going to birthday parties and having these issues, okay? We have not been effective at making socially valid and meaningful change. That's an issue. So our dimension that we're lacking effectiveness way more than behavioral. So far, B is our best answer. What about C, conceptually systematic? Is there any indication that we did not use ABA principles to tackle this goal? No, none of the information given implies we weren't conceptually systematic. We can't choose it. Remember, we're using the information given to us by the question, not adding based on our own experience or assumptions. And then technological, it's the same as conceptually systematic. Nobody's tried to replicate our intervention. We have no idea if it's technological or not. So we can't pick conceptually systematic or technological. So even if you don't think effective is necessarily the perfect answer, out of all of these, it's the best answer. Plus, we weren't effective because the client is still unable to dress themselves in public. So what dimension do we lack here? B, effective, which is A5 on our task list. Kevin's alarm clock went off at 8 a.m. on Friday. 5 minutes later, Kevin got out of bed and started his morning routine. At 9 a.m., Kevin sat on the couch and turned on the Masters golf tournament. Kevin drank 2 beers per hour and watched the golf tournament until 1 p.m. What was the frequency of Kevin's beer drinking? This is something that they like to do, is they give you a lot of numbers, a lot of data in a question, and then they try to trip you up because they ask about one specific data point. What are we asking about here? We're asking about frequency of Kevin's beer drinking. We need to isolate that from all this other stuff. It doesn't matter what time his alarm clock went off. No. Does it matter what time he got out of bed? No. What matters is how many beers Kevin drank. How are we going to get there? Well, let's look at Kevin drank 2 beers per hour. It's our rate. Okay. So we know for every hour Kevin was watching the golf, he drank 2 beers. How long did Kevin watch the tournament? Well, he started at 9 a.m. and went to 1 p.m. So 9 a.m. to 10 a.m. is 1 hour. 10 a.m. to 11, 11 to 12, 12 to 1. Kevin watched for 4 hours. If he drank 2 beers per hour, what was his frequency of beer drinking? It's going to be 8. Pretty simple question, but we need to, one, know the difference between frequency and rate. Plus, we need to isolate what's important in this question. 2 per hour is our rate, okay? Kevin did not drink 8 per hour. He drank 8 total, which is our count. And then 5 was just 5 minutes later when he got out of bed. Our answer for frequency, or how many beers Kevin drank, is 8. Scotty is a computer programmer at Google. He needs to learn a complicated task which involves multiple steps. After reviewing the task, Scotty knows about 80% of the steps already before starting. What type of task chain might be best for Scotty to use to learn the task? Okay. The exam is going to test your knowledge on not just autism, not just special needs, but on a variety of application for behavior analysis. Okay. In this case, we have a computer programmer at Google. What is the question asking? The question wants to know what type of task chain would be best for Scotty to learn this task. What's happening in the question? Well, in this case, it's a complicated task involving multiple steps, but we know Scotty already knows about 80% of the steps. What type of task chain do we want to use if our client already knows most of the steps? If we have a 10-step task chain and we're only teaching step 2 and 7, what's going to be best? Do we necessarily want to use a forward or backward chain? Well, we could, but it's going to be very slow. If they already know most of it, right, we're not really going to be helping them through it, okay? We're only focused on teaching a couple steps in the middle. So we might as well let them do the task on their own, teach the steps they need to know, and move on. So forward and backward are really going to be slower than our other option, which is D, a total task chain. With a total task chain, we're teaching the whole task all at once. And if Scotty already knows about 80% of the steps, this is going to be the most effective way. He already knows how to do most of it. There's just a few steps here and there that he needs to learn. Behavior chain interruption strategy, of course, is just breaking up the chain at different points to try to evoke new behaviors. Scotty's still trying to learn the task, so we're not quite there yet. But when your client already knows most of the task before starting, total task chain is typically going to be the most efficient and effective way to learn that task. Which of the following answer choices represents a response prompt? Okay, remember, we have stimulus prompts. We have response prompts. Response prompts acts on the response. Stimulus response or stimulus prompts act on the stimuli involved. Okay, very easy way to remember this. So we're looking for a prompt acting directly on the response. That word directly is key. A prompt that is focused on the response and not the stimuli surrounding the response. Let's look at A. You increase the size of the word you want your client to trace. If we are ever increasing the size of a stimulus, okay, that is almost always 99% going to be a stimulus prompt or a stimulus prompt, right? We're not necessarily acting on the tracing, we're acting on the stimulus of the word, okay? Remember that. B, while riding bikes, you yell stop at your client when approaching an intersection. You yelling stop, have you modified any stimuli in the environment? No. You're trying to get your client to stop using a verbal prompt. A verbal prompt is a great example of a response prompt. We're acting directly on stopping by yelling stop. B looks good. Do we stop there, or do we keep reading all of our answer choices? Read all of your answer choices. Find the best answer. C, you move the trash can closer to your client at lunchtime to encourage them to throw away their food. Positional prompt is going to be a stimulus prompt. Trash can is our stimulus in this case. And then D, you put a red handle on the mop and a white handle on the broom to help your client identify the appropriate tool. Again, you're modifying stimuli. When you're modifying stimuli, you are using a stimulus prompt. B, we're not modifying stimuli. We're acting directly on a response, which is to stop. Of the following verbal operants, which operant would you be least likely to reinforce with a generalized conditioned reinforcer? What do I always say? Operants, what do you need to know? What evokes it? What reinforces it? Formal similarity, point-to-point correspondence. You know those 4 things, you'll never miss an operant question. In this case, we want to know of the verbal operants, which would you least likely reinforce with a generalized conditioned reinforcer? And this is a really easy question if you know your material. Because if we look at A, we have manned. What do we reinforce a man with? Well, we reinforce a man with what was ever requested, straight up. So a motivating operation evokes a man. The man is displayed. We need to reinforce whatever was asked for. That's how you reinforce a man. Attacked, okay, just labeling, you can absolutely use, let's say our generalized condition reinforces a token. Should you reinforce attack with a token? Sure. Should you reinforce an intraverbal with a token? I say, what's your name? The client responds, here's a token. Absolutely, that's fine. What about an echoic? If I say touch red and the client says touch red and I'm training echoics, sure. Mans should always be reinforced, okay, with the item that was requested. That's how you're going to man train. So especially when it says least likely to reinforce with a generalized condition reinforcer, should always be a man. One of your supervisees writes the following goal. Dave will match a picture to an identical picture 5 times in a row, achieving 80% accuracy across 3 consecutive sessions and 2 RBTs as measured by trials to criterion data. Is this goal appropriate? What do you think? Do we have a learner? We do. Do we have a goal, or do we have a skill? Yeah, match a picture. Do we have a target or a criterion? 5 times in a row, achieving 80% accuracy across 3 consecutive sessions. And we have a measurement, trials to criterion. Is it objective? Yes. Is it measurable? Yes. Is it observable and clear? Yes. To me, it looks pretty good. Let's see. A, no, it is not objective. I think this is about as objective as you get, okay? Matching a picture to an identical picture, it's pretty objective. B, is it measurable? Absolutely. Trials to criterion data, the measurement is included, okay? So we need them, our criterion is 5 times in a row, so we're gonna measure that. B is okay. C, no, it is not observable. Absolutely, it's observable. Matching pictures is very observable. So like we talked about, this goal is definitely appropriate. Now, you might be taught a slightly different way to write goals. It's fine. Everybody has their own style. But as far as a technical way to write a goal, this includes everything you need. Objective, measurable, observable, clear. Outside of assessment results, what should behavior analysts base potential interventions on? This is ripped straight from the task list, okay? So outside of our assessment results, preference assessments, direct assessments, indirect assessments, what else should we consider when designing interventions? Should we consider opinions we read on social media? No. We are a science, okay? We should be using science and evidence for our interventions, conceptually systematic. Remember that. Opinions you read on social media should not be what you base interventions on. Now, if those opinions are based in scientific evidence, that's one thing. But just strictly opinions you read on social media should not be our go-tos for interventions. What about medical assessments? What if we know our client has chronic headaches? What if we know if our client is chronically constipated? On and on. Absolutely, that plays a part. We need to adapt to our client's needs. Medical assessments are very important in potential interventions. Do we pick B and move on? No, we keep reading. C, scientific evidence. Yes, that is straight from the task list. Everything we do is data-driven, evidence-based, empirical, scientifically driven, okay? So, outside of assessment results, what should we base potential interventions on? B, medical assessments, and C, scientific evidence. So D, both B and C. Gavin gets a job at a fast food restaurant as a cashier. His BCBA and RBT work on all the necessary skills that Gavin will need to be successful. They also teach Gavin to ask for feedback from his boss on how he is doing. What is the BCBA programming for by teaching Gavin to ask for feedback? Okay, what are we focused on here? We're focused on the part of the question where Gavin is supposed to ask for feedback. And if Gavin is requesting feedback from his boss in the natural environment outside of the trained environment, what are we trying to do? Okay. And be careful here, right? Because when we are asking the boss for feedback, okay, we're trying to contact reinforcement, okay, in the natural environment. So are we trying to differentiate? Well, differentiate is the difference between multiple responses. And we really don't want Gavin to differentiate his responses, right? We're going to work on all the skills. We want Gavin to execute the skills we work on at work. Differentiation is not really our goal. What about response generalization and stimulus generalization? Do we want Gavin to start generalizing responses, okay, and showing off new responses for one stimulus? So if we have a cash register and we teach Gavin to work it, do we want Gavin to start engaging in different responses? Well, maybe, but when we're asking for feedback, that's not what we're trying to accomplish, okay? Same with stimulus generalization. We're not trying to have Gavin engage in one response across multiple stimuli due to the teaching or due to the feedback from his boss, okay? What we're trying to do is get Gavin's behavior to maintain. And the only way Gavin's behavior is going to maintain is if it contacts reinforcement in the natural environment. Feedback from the boss is going to act as a form of this, hopefully, reinforcement. So you have to be careful, right? We're not focused on the generalization aspect here. We're focused on our skills maintaining from when we teach them with this natural reinforcement of feedback from the boss. Our answer here is going to be D. You have to be very, very precise in what we're asking about. We're asking about, okay, the feedback, not necessarily all the other stuff we're teaching, just the feedback from the boss. When would it be most appropriate to use a DRL procedure? What is DRL? DRL is differential reinforcement of lower rates of behavior. Do we teach a replacement behavior with DRL? No. Are we trying to eliminate the behavior with DRL? No. We're just trying to lower the rate at which it occurs. So that's going to be our guiding light on what answer to pick. We need an answer where we're not necessarily teaching a replacement behavior and we're not necessarily eliminating the behavior, we're just reducing it. So A, working with a client who engages in headbanging against a wall. Are we looking to reduce headbanging or eliminate it? Well, we're obviously going to want to eliminate headbanging. We're not just trying to use a DRL to reduce it to more socially valid levels. Headbanging against a wall is never really socially valid. B, working with a client who needs to read more pages in a book each night. Well, this is targeting increase. DRL is targeting decrease. You can eliminate B. C, working with a client who eats an unhealthy amount of apples. Okay. Now, are apples, let's say 1 a week, necessarily bad? No, it's actually pretty encouraged to eat fruits and vegetables. But if your client's eating an unhealthy amount of apples, let's say 10 apples a day, and he's getting cavities and diabetes and that kind of thing, we might just want to reduce the amount of apples he's eating, not necessarily eliminate them, especially if he really likes them or whatever the case may be, but we do want to reduce it. C so far is the best case for DRL. We can lower the rate of apples eaten per day. And then D, working with the client who elopes from the classroom when given a task demand. Again, like headbanging, do we want elopement to occur occasionally or not at all? Well, really not at all, right? We'd rather our client eat 1 apple a day than elope 1 time a day, okay? So C is going to be best to use a DRL.